name is Dr. Kwc2015 Lyons. I'm a chiropractor and co-owner of Kwc2015 Chiropractic in Toronto. Today I want to tell you a little bit about chiropractic, the technique that we use, which is called an activator, and the protocol that we use with our patients to use the activator to adjust the vertebrae back into a better position when they're misaligned. With the activator, it is based all on the fact that most people have one leg shorter than the other. Technically, it is not that your leg is actually short, it's due to the fact that there's some misalignments somewhere in your spine that is making your leg look shorter than the other side. So what I'm going to do is just look at Dr. Chan and see which side of her body is causing her leg to go short. And then I'm going to go through and show you some adjustments on the mid-back and the neck area, as well as the shoulder. A lot of times people will come in and they've had tension in their neck, carrying their bags, laptops to and from work, just even commuting on the GO train or on the subway. So I'm going to check Dr. Chan's lower cervical area, so C7. So at this point I'm going to ask her to turn her head straight down into the table. That seemed fine for her, so I will not adjust that segment because her leg length stayed the same. With headaches, a lot of times the occipital or the upper area in the neck will get tight, so I'm going to check that now. So I'll have Dr. Chan just look up in front of her, and that tests C5, and then I'm going to see that it was fine, and then I'm going to ask her to push her face down into the table. Good. And now that came up short, so I'm going to adjust that segment. And again, go back and verify that that adjustment took and everything is level. One of the other things that we like to check is the shoulder area, again, from everything that I've said before, from being in front of the computer. So I'm going to check the second and third vertebrae and their facet joints like to get jammed up. So I'm going to ask Dr. Chan to do the front crawl swimming motion with her right hand. And that showed that the right leg went short, so I'm going to go back again, and I'm going to find the second and third vertebrae, and I'm going to adjust their facet joints. Verify that everything has balanced, and then I'm going to ask her to put her right hand on the back of her head. So a lot of times the shoulder blade or the scapula gets stuck. And what will happen is that the muscles in that area will start to pull it up. So I'm going to get her to bring her arm back, and I'm going to adjust that shoulder blade and push it back down so that the muscles in around that area also have a chance to relax. Once the legs have been balanced, we'll always ask if you have any other complaints that we haven't touched. So sometimes something will happen between appointments. So we just want to make sure that everything is balanced out and that we've been able to touch everything that needs to be touched and realigned, so that your whole nervous system is able to work at its optimal level and that you have a healthier nervous system, which means you have a healthier spine.